I think diversity in research is important because, again, we are interested in research not just for the sake of research, but research for the sake of impact. We sometimes like to criticize research from a number of decades ago as focusing primarily on healthy white males. We need to produce research that involves the kinds of patients and settings where the research findings will be used. And that requires diversity and representativeness and a much broader approach than was typical of a number of years ago. I think that the key strategy for engaging diverse communities involves beginning with essentially leader-to-leader contacts or contacting representatives of the communities that we seek to engage with, identifying individuals who are key members of the community who represent opinion leaders in a sense and who understand the needs and the values and the perspectives of members of their community.
It's important to think about diversity in research because it allows the service-providing medical community to be more sensitive, responsive, and attentive to the needs of a diverse community. Being responsive to the needs of a diverse community makes people feel more welcomed, included, and able to share their most personal circumstances when they are often in vulnerable situations. The most effective way to engage patients in patient outcome research is to look hard for communities of people who are underrepresented, ask them what they need, respond to their requests, and encourage their involvement. The most effective way to disseminate research findings is to inquire about what formats or approaches people are best able to receive their material. Blind people, for instance, may prefer to receive material electronically using assistive technology to access information. Alternatively, they may prefer Braille or large print. Similarly, other communities who may not deal with vision loss may need access to information via the telephone, conventional print, or otherwise. It's simply a matter of inquiring about what people need and responding accordingly. The advice I have for these researchers is to listen, respond, and help fashion a program that will attend to the needs and circumstances of the diverse communities that are served.
We live in a diverse country, as everyone knows, and we need to understand the importance, I believe, of multiculturalism, not just the melting pot, but understanding that we need to understand that everyone brings a different perspective and a view of how they should be viewed as a patient, how their culture should be a part of understanding how they gather information, and the fact that by 2030, there will be no minority. We will have many other cultural ethnic backgrounds here, so we need to make sure that the entire country is covered with good, equitable treatment. As a former community health worker, a lot of what I hear from community residents and people who are in treatment in various clinical settings are saying that it would be nice if some of the researchers would actually come out into the community. So to reach the community where they are, in churches, community centers, just going through the neighborhoods and just asking questions, doing more of the on-the-ground work to really incorporate patients and saying, we're here for you, not you need to come and be for us. I think we need to look at multiple ways of effectively disseminating through community events, not just in the newsletters and on the internet. Our community is getting more savvy in digital internet age, but people who are marginalized and in poverty may not have access to a lot of the technical things that are going on. So again, we need to go in the communities, be on the ground, and disseminate through various community activities, make it a celebration for the community to understand that the process that we're going through in incorporating people in this type of research, and show how the benefits will help their children, their grandchildren, and so forth.
What is the research that we need to do in order to understand how best to engage patients who may not have traditionally been a part of the research context? It's one thing for me to stand here as a clinical investigator and give my opinion about how to engage people, but really that's an empiric question that I think is not only testable, but it must be evaluated in order to define a set of strategies that we can use in order to engage populations and bring them into research. There are a number of lessons that we've learned, particularly from the body of work in community-based participatory research, but also from a fair amount of qualitative research that's been done in a number of treatment contexts. And these lessons have to do with engaging people in ways that are meaningful and understanding to them, to potentially engaging the community rather than just engaging the individual, to understanding different people's decision-making preferences and different people's understanding of healthcare decisions, and also developing mechanisms to aid people in becoming activated so that they have the tools themselves in order to engage either research or the healthcare system.
It's important to think about diversity in research because we have a diverse culture and a very diverse country and population, and one size does not fit all. And so how we reach people, have them understand the importance of participating, the importance of not just what it means for them, but for their children and for the future of a community, for a city and a state. It just allows them to understand that this is part of giving back as a citizen and as a person who really cares about this community and this country. We can engage diverse patients by talking to them and having them tell us how we can engage them. Much of what we do in healthcare is to be paternalistic and assume that we know what's best for people. But in the end, we understand, particularly as clinicians, that patients tell us the answers to their problems. Our job is to listen more intently and through listening, figure out the solutions to engaging them. But we can't do it without inviting them, but also going and meeting them where they are and then finding solutions with them to how we can provide better results and outcomes. Researchers initiating a patient-centered outcomes research study should first approach it with humility, in the sense that you don't know it all. The patients do not care about your credentials or where you came from. They first and foremost care that you have some concern for them as a person. And so understanding that they are the expert, not you, will carry you a long way, and that we have to do this together. And there's an old African proverb that says, if you want to go fast, you go alone. If you want to go far, you go together. And so the researchers need to remember that this is about doing this together, and that'll take us all so much further in improving health outcomes.
Hi, I'm CYNTHIA CHAUHAN. I'm on the External Advisory Committee for the Patients Program. I, in my own life, am a patient. I have a number of chronic illnesses, including heart disease, and I'm a survivor of 2 cancers. So I have a lot of experience as a patient. I also do a lot of volunteer work as a patient advocate, particularly in research and some support work. In the context of patient-centered outcomes research, my role is primarily to provide the patient perspective, to be a representative of the patient voice, to make sure that it truly is patient-centered. I think that PCOR is important to the typical American because at this point in PCOR, which is a fairly new program, new ideas about how patients are involved in their own care and involved in the development of care models is being formulated, so that as we move down this path, patients throughout the country will have a more active, affirmative role in the development of their own care and understand better that they are partners in their care, not subjects in their care. From that, hopefully they will move to understanding the importance of research and the importance of the patient voice in research, so that they know that research is there to facilitate better care. It's not just a separate silo where some things are done. Rather, it's an avenue to enhance and improve care, and they can have a voice in that. I think disclosure is important. I am a social worker. I have been for many years. I think it is an incredible field, and what it has to offer is when social work is at its best, its job is to facilitate and affirm the person's right to their own voice and their right to seek what is best for themselves from their community. PCOR can facilitate that. PCOR also is, I think, a way for patients to have voice and to own their role in the development of good care, not only for themselves, but for the whole community. So I think social work and PCOR are natural allies. For researchers to create an environment where patients own their role in the relationship, researchers need first to understand that patients have a role and to step outside of the box of I'm a researcher and remember that they also are people and are likely at some point in their lives to be patients. So to let themselves value, the patient comes to them as an equal partner but with different skills and different abilities. The skill that the patient brings to the researcher is presence of patients at the table, looking at the research questions from the point of view of what does what you're doing do to facilitate people having better, healthier, longer lives. So if the researcher can let themselves be open to listening to the patient's understanding of what they're doing and presenting what they're doing in such a way that patients can understand its relevance to their lives, I think that will facilitate the relationship between the two. When I think about engaging patient advisors in the research process, I think the first step, as we just talked about, is for researchers to understand that there is a role for the patient in the research process. The second step is to reach out to clinicians who have regular contact with patients and ask them if they have patients who are interested in doing this. One of the things that is often true of patients that gets overlooked is when patients receive care that helps them to live a better life or even to understand the limits of how much better their life can be, they often become very interested in giving back. There's a natural altruistic quality that most people have where we want to give back. So when the physician turns to their patients, often they already have patients who have said to them, "What can I do to be helpful?" So the treating physician can be a bridge between the researchers and the patients to bring them together, being respectful of the different expertise of both the researchers and the patients as they bring them together. I think you need to understand that you will have a steep learning curve, and that's okay. So go in ready to ask questions. Understand that some of the things initially will seem over your head, but it's an immersion process. The more you hear it, the more familiar it becomes, and the more willing you are to ask questions, the easier the learning will be. Sometimes the questions that you ask also are meaningful to the researchers in that it helps them to look at their research differently, to frame their questions in a different way. So even though initially you are very much in the learning position, because you're both human beings, there's an interaction, and you'll be learning from each other. So I would say relax, let yourself learn, and grow in the position. It'll be one of the most rewarding things you ever engage in.
My name is Ernestine Shepherd. I am 78 years of age, and I am the oldest female competitive natural bodybuilder in the world. I also train people at Energy Fitness and Wellness Center, and I also love to take people out to walk to keep them healthy. I started exercising at age 56. What inspired me was the fact that my sister and I were invited to a church picnic. We were told we could wear bathing suits. We hadn't had a bathing suit on in years. We went to purchase them, and when we noticed how we looked, we then knew that we needed to start some type of exercise. So what she and I had done, left the bathing suits there, didn't put the bathing suits on at the picnic, but within that following week, we started an exercise program at Coppin College. Wanting to become a bodybuilder, I knew that I had to have some type of routine, some way to actually get started. So in order to do a bodybuilding show, one must first clean up their diet. The next thing you have to do is to actually do some type of exercising. So what I did, I started walking. That walk then turned into a run. I started picking up weights, and I started training 3 to 4 times a week. I got a mantra. My mantra was determined, dedicated, disciplined to be fit. And with that mantra, that kept me doing the things that I knew were important to become a bodybuilder. First of all, I knew I had to be able to really know how to squat. Wow, that was really a job for me. But actually, I was able to overcome that. Then there were other things. I knew that I did not want to take any type of supplements. What I wanted to do was to remain being very, very natural, because I wanted to inspire others to live and to be healthy the natural way. So there were times when, I thought, oh, it would be nice to take some supplements, because then I would really get big. But that wasn't the thing that I wanted. So I did absolutely nothing but ate correctly. And what I did, which was very, very good for me, I started drinking international egg whites. And that was my protein, because to become a bodybuilder, you do need quite a bit of protein. And I needed to have at least, I think, 126 grams of protein a day. And that was really natural, drinking the egg whites. Well, when I first started working out, I had a sister. I loved her dearly. She died with a brain aneurysm, and that really tore me apart. I was very, very nervous. I was on antidepressants. I had developed high blood pressure, panic attacks, you name it, I had it. But after prayer and getting myself together and started working out, I found that all of those things left me, because by being busy working out, I immediately forgot about those problems that I had. And I can tell you to this day that I am not on any type of medications due to the fact of exercising. And then another thing, I find that when I'm sort of down and depressed, you know what I do? I lace up my sneakers and I get out and I go for a run, walk, and that helps me tremendously. Spiritually, well, I knew that I needed to really start with prayer, so I started praying each and every day. Believe you me, prayer takes care of a lot of things. And spiritually, you know that you're helping others when they know that you take time each morning before you do anything to have your devotions, your meditations, and your prayers. I like for patients to know that I say all the time that age is nothing but a number. Now, most people are told if they're sick and they are a certain age, they'll say, oh, well, we expect that because you're a senior. You should fall apart, this should happen. But don't you know that makes that person feel very badly when they hear that. We don't want to hear that. We want to know that we can still get up and move around even though we're 60, 70, or 80. And there are so many different things that we can do to move around. No, we aren't going to jump around like the young bucks, but there are things that we can do that can keep us motivated and keep us moving about. And in my exercise classes, that's what I tell them all. Age is nothing but a number. And the things that we do, we can do it, and we show some of the youngsters some of the things that they can't do that we can do.
There's a disconnect, often a disconnect, between your primary care physician, the insurance companies, the people who are providing you your meds, your pharmacists, and they're all talking to you, and if you're not alert, if you're not on your JOB, you're going to miss something, or you may not be able to get the treatment that you actually need. I'm delighted that you guys are working on issues like this, because by talking with one another, I think we'll be able to address things like that and resolve them. And that's what my hope is, and that's why I'm here today. I thank you for inviting me, and I look forward to working with one another.
I come from being educated academically in high tech. I'm an IT person. I've run IT companies for years, and then about 10 years ago, something happened, and Ruth, I left IT and started pastoring a church. And so I go to the church and I'm going to bring IT to the church. What a mistake. What a mistake. And what I learned is that my almost 400 people are definitely high touch. The community does not have true high-speed data access. And that plays a big deal when we're talking about high tech versus high touch.
More and more we're seeing other ways that patients can get data to us, wearables, various other pieces of tech that are available. But the question ends up being, is this high tech really against high touch? Or is there some way that high tech helps us reach out and create some high touch?
When I was thinking about, and as we had chatted today about what you needed to know if you wanted to work in or to conduct research in a rural setting, there were a couple of points that I wanted to make. And the first thing I alluded to earlier was expect our patients to want to be involved. They're excited about it. They weren't for sure that they'd ever have this opportunity. They may be a little bit cautious. They may be quite a bit inquisitive. It may take a little bit longer to kind of obtain things like consent, but they really want to be involved.
We want what's best for our patients. And so at times it may seem like we're protective or trying to put people off, and it's really not the case. We're trying to understand what's the win-win in the situation. And it can't be seen that you're just coming to do research on the patients or to use the staff to collect data. It really is, if we're going to have a partnership, how do we all have skin in the game? How do we all win? And at the end, particularly, how do the patients get better served. And our whole concept is around servant leadership, which at the end of the day is, are those that you serve better off?
I started exercising at the age of 56. I had never done any type of exercising at all. I started walking, I started lifting weights, I started eating correctly, I started with my prayers and everything. And don't you know that today, at 78 years of age, I do not take any type of medication. All of the medications that I was taking, I no longer take them. And I'm here to tell all of you, it is not difficult to get started. My mantra is determined, dedicated, disciplined to be fit. And then I adopted another one, that age is nothing but a number. And another thing I say, if ever there were an anti-aging pill, you would have to call it exercise.
Do not be afraid for standing up for what you believe. What you do, no matter how small, will make a difference. A candle is a protest at midnight. It is a nonconformist. It says to the darkness, I beg and dare to be different.
Okay, now we're in the stairwell. We're going to do some functional exercise. Remember to always check with your doctor before beginning an exercise program. If you're having any problems with your knees, your back, or your hamstring, please try to avoid the steps. But what I'm going to show you is how to walk the steps and how to walk them proper. So you want to have your abs tight, back straight. If you have to, place your hands on the rail, abs are tight, and you walk up, one at a time, squeezing your abs, squeezing your glute, up the steps. When you get to the point where you can walk comfortably without holding the rail, you still keep your shoulders back, abs are tight, arms are right around your waist, and you breathe, and you walk smoothly up the steps. Now, Laverne, what I'd like you to do first is demonstrate walking up the stairs using the rail.
Okay.
And what you want to do, once again, what do you want to concentrate on? Doing what?
Breathing.
Breathing.
Core.
Keeping your stomach engaged.
Did you say squeeze the glutes?
Yep, squeeze the glutes when you come up.
Okay.
Good, good. And let's
Back straight.
Back straight. There we go. And breathe. And let's walk up those stairs. Good, 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 good. Good, breathe, good. Now I want you to go down and come up without holding on to the rail. But remember, there's always the option to hold on to the rail for safety, but when you get to the point where you can comfortably walk up and down the stairs and you don't have to hold on to the rail, the same thing applies. Abs tight, back straight, and again. Excellent. When going down the stairs, you want the same method to apply. Back straight, abs are tight. Keeping my back straight. I don't want to lean forward and have the gravity push you down. When I'm walking down the steps without holding on to the rail, same applies. Abs are tight. Each step I grab and catch my balance. Squeeze my glute. Make sure that I have balance coming down, okay?
So you're going to do it holding on first.
Yep, holding on first. Abs are tight. Squeeze. Good, good. Excellent. Now then you're going to walk down the steps without holding on. Good. And if you walk up and down the steps, let's say 2 to 3 times, that is an excellent workout. There we go. Good, good. Body weight, perfect. Perfect form. Good job.
Now, is there any danger if I do that fast
Yes.
You know, you're looking at a certain amount of steps, you want to get up as fast as possible.
The danger when doing it fast is you may not catch your balance and you could fall. So there's no rush. You want to walk up and down the steps as slow and safe as possible so you don't injure yourself. Because once you start the train going, falling down some steps, it's not a good thing. So walk slow and efficient, touching each step. Don't skip any steps. And there's always that option to hold on to the rail. Nothing wrong with holding on to the rail. Don't skip any steps. Make sure you keep your balance. If you're getting dizzy or lightheaded, stop and take a break. Okay, Laverne, we're at our next machine. We're going to be doing and working our back muscles, And what is the first thing we need to do when we get to a machine?
We're gonna wipe it down.
We'll wipe it down. There you go. So, there's your wipe.
Thank you.
And as you wipe, I'm going to tell you that when you're exercising, it is important to have muscle balance. If we do the back, we have to do the chest. So once we finish the back muscles here, we're going to move over to the chest press, and we're going to do the chest press. Now, do you remember when you asked the question of how do you find the weight and which the weight number you should judge?
Yes.
I'm going to have you pick the right weight today. So go ahead and find the weight.
I think I can do a 40.
There you go.
Comfortably.
Okay, comfortably 40, comfortably 40. I believe you can do it comfortably 40, but I'm gonna go down 10 more.
Okay.
So let's go to 30.
Great.
The reason I say that is that most rehab weight, rehabilitation, physical therapy is usually 5, 10, 15, 20, 30 pounds. So if you always stay with 30 pounds, you'll never be too heavy to pull and injure yourself.
Right.
Not that you can't do 40, but we'll always start with the rehab weight first.
Great.
Okay? So I sit down once again, I get a good alignment, my knees are aligned, feet are aligned, back, I bring my hands in, I breathe, exhale, 1, stretching the back muscles, don't let it touch, just like that important question you asked. If I let it touch, then I rest. I don't want my muscles to rest, I want my muscles to continually activate. So, 1, back, I'm not jerking, 2, 3, and we go to 5, okay?
So when I'm pulling back, I don't have to go all
No, you don't want to go back. You don't want to go back past your range of motion,
Right.
because what you could do is you could injure yourself. That's how we tend to pull and injure our muscles. You just want to come back. Because I'm going to place my fingertips right in the back of your blade so you can feel those muscles. So come on in, sit on down. And remember, never let anybody rush you. Take your time, come into the machine, and relax and breathe. Make sure you get, yeah, there you go, there you go.
Should I be leaning on
Good,
or
good,
just
good.
stand?
Yep, you want to lean in. There you go. That's what that's. Yep. So you can grab. There you go. Inside. There we go. Good, good. Pull it to you. I pull it to you. There you go. Good,
Okay.
good. Grab it nice and tight.
Yeah.
5 fingers around and begin. My fingers are in your back. You should feel it right in there. Feel it right there.
Yes.
Good. Perfect. 1 deep breath. Make sure you breathe. Oxygen in, oxygen out. Oxygen goes to your muscles, feeds your muscles, and makes the movement a lot easier and prevents injury and helps with recovery. 3, good, 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 excellent, Vern. 4, and here's the money ball coming up right now. Good, and 5. Good, good, bring it out. And where did you feel it at, Laverne?
Actually, pretty much here.
That's right.
At the
That's
middle part.
exactly the latissimus. Right here, right in that back, feeling it right in there. Now from the back, we're going to go over to the chest so we can make sure that we have muscle balance, okay? All exercises, you want to make sure that you sit down and you're doing them with proper form. My feet are aligned, my knees are aligned, chest is out, abs are tight. I bring my arms back, bring my elbows in, and I extend. I take a deep breath in, I exhale, coming out. I don't go down all the way, and I control the movement coming back, nice and easy. Blow out. Inhale, exhale, blow out, bring it in, 3 and 10. Laverne, anywhere between 8 and 12 comfortable repetitions, this means how many times you do it, is a good number for a set. So what I'm gonna do is I'm gonna have you sit down, align yourself, and you're gonna do 8 to 10. I'd say 10, so we're gonna do 10. So I'm gonna switch with you. Sit down, get your alignment. There you go, good. Knees are aligned, your toes are aligned, you feel comfortable, okay? Yes. Place your arms back. Good, elbows in. Now relax and breathe. I'm gonna place my hand on your back to make sure that you're going down with a smooth rhythm. So you're gonna blow out and inhale, coming back, and let's begin. Good. 1, nice and easy, good. Come on back, follow my rhythm. There we go, blow out. 2, good, good, go down. We're only gonna do 5, good, good. 3, good, good, abdominal. 4, and 5, excellent. Okay, now I'm going to demonstrate fitness from your desk. Laverne and I are going to do some fitness moves from your desk or your workplace that you can do, 3 or 4 times a day in the office without leaving your office space. So the first thing we're going to do, Laverne, is we're going to sit with good posture and form in your chair. So when I'm sitting in my chair, my shoulders are back, abs are tight. I'm going to move back with my feet, scoot back a little bit. There we go with my feet. And I can take my right leg, place it over my left, put my ankle right there. I'm going to take my right hand and I'm going to put a little bit pressure. You're going to feel it stretching. Feel it stretching right there. Feel it stretching right around the hip flexor, growing area. We hold it there for 3, 2, 1. And notice we're still not leaving our chair. Opposite, cross your ankle. My boss is like, oh, Chauncey's still at his chair, so he must be working. Going to stretch, push it a little bit. 3, 2, 1. Good. Now, from the chair, I scoot back just a little bit. In posture form, I'm going to take my arm. I'm going to bring it around by my back, still on my desk, and I'm going to stretch out my tricep. Stretch, and I'm going to hold it there for 3, 2, 1. Opposite. This will help you relieve stress at the office place. There we go. Fingers, there we go. Good, good. That's good. We're not good. 3, 2, 1. Good. Now, I'm going to place my hands over it. Good, good. I'm going to turn a little bit in my chair. 3, 2, 1. Opposite way. 3, 2, and 1. Good, good. Now what we're going to do is we're going to get up out of the chair. And we're going to swing our legs nice and easy and control it. 1, perfect, Laverne. 2, working the hips and hip flexors. 3, opposite leg, because you don't want to make sure that you don't want to swing too far and kick your colleague in the office. 2 and 3. Good. Now what we're going to do, I'm going to use the back of my chair to stabilize myself, and we're going to do some chair squats. Major muscles we're going to work is hamstring, glute. I'm going to squat and come back up. Squat. 2, there we go. Hamstring. 3, glute. 4, breathe. 5, last one. 6. Good. Do you have any questions about some of the exercises you can do from your chair?
Now, one thing I always make sure when I'm sitting at my desk is that my feet are flat.
Good, good.
But because, the computers are going on, I end up like this sometimes, and I don't know what's going on.
Hey, remember what I just said. So that's what you want to do. If you have 60 minutes, 40 minutes every hour, look how long that took. That took us less than 3 minutes. The first thing I said was posture and form. Because when we're at our computer, at our workstations, we slowly start here, but we wind up here. We wind up here. So we have to remind ourselves to come back to here. So every hour on the hour, every 30 minutes, you could take 30 seconds, 20 seconds out just to do what we just did. First, I come back, work on my posture and form, shoulders back, abs are tight. Then, believe it or not, you can work your abdominal area from your chair too. Scoot back a little bit, squeeze my abs, and I twist. 1, there you go, feel it. 2, suck it in. 3, 4, 5, 6. Also, to release some of the stress from the lat, I call hand your package back. 1, over the shoulder. 2, stretching out. 3, 4, stretching the lat in the back. 5, 6, and then I go the opposite way. 1, there we go. 2, 3, deep breath. 4, 5, 6, and neck and face. For some of us, we remember that old exercise guru, JACQUELINE. The most important muscle that he worked on was the facial muscle. Why? Because that was the muscle we used to smile and greet people with. So what I tell people, you sit in your chair, move your facial muscles around, move it around, there you go. Good. And then just do a big smile. Take a big smile. There we go. Move your neck around. Don't hyperextend it. Move it to the right. 2 or 3 times. Move it to the left. And then you scoot back to your workstation. Place your hands on your keyboard and continue to work.
Hello, my name is Jacqueline. Welcome to Yoga Moment. I'm a certified yoga instructor and I'm delighted that you decided to join me today. Before we get started, as a brief reminder, please be gentle and respectful of your body as you go through the practice. If you're doing any pose that's painful or that's extremely uncomfortable, discontinue that pose. You should feel a little bit of a stretch, but you don't want to feel any pain. So always be mindful of your body's abilities and its limits. Also, it's always a good idea to speak with your physician before starting any new exercise program. With that being said, let's get started. The pose that we're learning today is called the garland pose. It's a great thigh stretcher. It is a really good hip opener. As a matter of fact, it's a pose that mothers sometimes use in labor. But don't worry guys, you can do the pose too. So, with that being said, let's get started, and I'll give a couple of different options for doing the pose depending on your flexibility. So the first thing that you need to do is come up onto your toes and let your toes point out just a little bit. Come as high as you can on your toes, and this is where you are. Then let your toes point out, get your balance, bring your palms together at heart center. If you have a little bit more flexibility, then you can bring your hands down and you can come down to be on your entire foot. Bring your palms here and use your arms to kind of push your thighs apart. Sit up nice and straight. Take a nice deep breath. Exhale. 3 breaths here through the nose. Great job. Gently sit back. Bring your feet back. Sit back to easy pose. Deep breath. Exhale. Great work, guys. Thanks for joining me. See you next time.
Well, the first walk started in July 2013. Miss Ernestine Shepard, the Guinness Book World Record holder, oldest female bodybuilder in the world, her and some of her female clients wanted to get together and walk with her. They enjoyed it so much that we decided to walk each and every month. Usually when you come to our community walks and you may not be in great shape and you get a hug, you wind up talking and then you wind up walking. If they can only walk 10 feet, we're fine with that. Come on back and just feed off of the love and the friendship here at these community walks.
We have CHAUNCEY in the house. There you go.
What I think they're doing for Baltimore is they're bringing all the different communities together. And through walking and talking, we're also talking about some of the issues that face Baltimore, not just in the health and the fitness realm, but in the other issues that have plagued the city. And we realize that working together in a team effort, we can combat all the different ills that face our city.